Okay, good afternoon, members and visitors to the Health and Wellbeing Board. We are now live on the internet, so this meeting is available to members of the public. The meeting is being held remotely. I'm in County Hall, as I say. I don't intend to put my face camera on. I am in the room that's marked the ICT Surface Hub. I'm here with Matthew Hand, who's our officer. It is being held remotely, broadcast live via the County Council's website, and it will be archived so that it can be viewed afterwards. Before we move to the first agenda item, I will quickly confirm the names of those members who have joined us today. From County Council, we have Mrs Radford, we have John Wilson, Mike Sands will be joining us later. From the clinical commissioning groups, I have Caroline Trevithick, Sarah Prima, Dr Lakani will be arriving late, and Dr Barakantam. From the districts, we have Jane Toman and also Councillor Kaufman. From the LPT, we have Daniela Cicchini. From NHSE, we have Hayley Jackson. From UHL, we should have Simon Pitsey, he'll be arriving late. He has a slight apologies there. From the police, we have Chief Superintendent Adam Streets. From the Office of the Police and Crime Commissioner, we have Paul Heinsohn. And from Health Watch, we have Becky Engley and Harsha Katecha. So have I missed anyone who's online at the moment? If so, please do say.
Yes, Chair Jane Moore from County Council.
Sorry, Jane, you're with us. Okay, thank you.
Thank you.
You're presenting, so thank you for that. May I remind members to turn your microphone on when you want to speak and off again when you have finished speaking. If you see your signal breaking up, it's probably best that you disable your camera, and that might help your bandwidth. If you want to speak, can you please use the hand raise button? We are monitoring the chat, but that'll be through Matthew, but the raise hand seems to work a lot easier. It's therefore advisable that we try not to use the chat if possible. I've received apologies today from John Sinnott, from Mrs Deborah Taylor, from Mr Richard Blunt, and Mrs Radford is subbing for Richard. Lloyd Back is unavailable, so Paul Heinsohn is subbing. Andy Williams is unavailable, so Caroline Trevithick is subbing. Mark Whiteman is unavailable, so Simon will be joining us and subbing for him. And Michael Smith is unavailable from Health Watch, so Becky is subbing for himself. And also apologies from Councillor King. He may be able to dial in towards the end of the meeting, but he does send his apologies. A quick change to the order of business. Due to the Director of Public Health, Mike Sands, being unable to make the start of the meeting, I propose to take item 6, the coronavirus impact and response to the local care system, of which Mike will jointly present, be considered slightly further down the agenda after item 8. So I hope that's okay with everyone. Okay, thank you. I'll go to the agenda. Item 1, minutes and action log. I propose that the minutes of the meeting held on the 9th of July 2020 are taken as read, confirmed and signed. We also have behind that the action log attached, which demonstrates progress with the actions agreed by the board. So well done everyone in getting those done. Item 2, urgent items. I have no urgent items. Item 3, declarations of interest. Do any members have any interest that they wish to declare in respect of any items on this agenda? I'll look to see if any hands go up, but I'm seeing nothing there, so I'll take that as none. Item 4, next we have my position statement. Copies have been emailed to you, and a version is also published on the Council's website. My position statement references the crucial work undertaken by health, social care and community partners during the ongoing coronavirus pandemic in order to protect residents, local services, and in particular our most vulnerable groups. On behalf of the board, I'd once again like to thank all of those who continue to manage and deliver the local response and our recovery work. Among several other things, the position statement details the events that were organised by the County Council-led Start a Conversation partnership in connection with World Suicide Prevention Week and Day. The excellent work of the Tomorrow Project, a confidential suicide bereavement service commissioned by the County Council in partnership with Leicester City Council and the Office of the Police and Crime Commissioner. The promotion of the weight management services, which aims to raise awareness at this time of the service amongst residents, emphasising the personal support available and tying into the national Better Health campaign. And finally, the social media campaign to promote the launch of the Warm Home Funds to encourage residents to get ready for winter now by applying to the project and or to contact the existing Warm Home services for advice on staying warm and helping to cut fuel costs. Moving on to item 5, which is a report concerning the consultation arrangements on the acute and maternity reconfiguration at Leicester's hospitals, which is page 11 and 18 in your agenda pack. This report provides members with information concerning the consultation approach on the proposed reconfiguration of acute and maternity services within Leicester's hospitals. Caroline Trevithick, Executive Director of Nursing, Quality and Performance and Deputy Chief Executive of the LLR CCGs, will present this report. So Caroline, if I can hand over to yourself, thank you.
Yeah, thank you very much, Chair. So I want to pull out some key issues in the paper, and then obviously we can pause for questions. It talks about the consultation. The consultation is seeking views from patients, staff and carers on the proposed changes to services at the Leicester Royal Infirmary, Glenfield, and the options around the general, but also focuses on services provided from Melton in the form of the St Mary's Hospital, the maternity unit there. And we're also looking to seek views on specifically around the hydrotherapy pool at the Leicester General Hospital, and really give us opportunity to think about how it impacts on people and any alternatives. So the consultation starts tomorrow, and on Monday, every single household in Leicester, Leicestershire and Rutland will have a post drop, so something that goes through the door of every single household. And we have put in place a number of virtual face-to-face meetings with people across the next 12 weeks for people to be able to engage with us and seek feedback. And we've also requiring people to submit electronically as well through our website, and the web address is included so that people can submit their queries. I think it's important to acknowledge that we are still doing this despite the fact that we're in a global pandemic. And the rationale for doing this is because we still need to make those changes that we believe need to be undertaken in our acute services. And I think that COVID itself has demonstrated how much we need to progress with this work. We have sought clarification from NHS England, from our legal team, CCG governing bodies and our equality and diversity team to ensure that our consultation plan is appropriate, particularly given the current position with COVID. And we have been supported in continuing. I suppose it's important to know that we will be doing a mid-consultation review, though, just to see how it's going and to see whether or not anything has changed that. And the consultation plan was shared with the Joint HOSC back in August, and they went through the details of the programme. We will be sending comms directly to councillors and parish councils particularly, and during the consultation, Jane, you'll be pleased to know that we're going to be working with the districts to ensure that we've got those things in place for that. So it really is, the consultation is the opportunity to give a voice to our local public and stakeholders to consider how the proposed changes will impact on people, seek their views to understand what that might be, but we need to make sure it's across that diverse population that we have in Leicester, Leicestershire and Rutland. And we're trying to make the best of the mediums that we've got available to us, so that people have got the opportunity to write to us, to engage through the internet, or to engage face-to-face in those virtual meetings. We were also trying to be fairly sophisticated in looking at some of our social media opportunities, so that we might, if we're picking up anything particular that's bubbling up to the surface, that we can change and respond to those issues straight away and work with those local populations accordingly. So I think I'll stop there, if I may, Chair, and take any questions on the paper.
Okay, thanks, Carol. I mean, the only observation I made, I mean, if you're going to do a consultation, I think what you're dealing with, page 14, the online focus groups, virtual public events, virtual outreach, the displays, the online briefings, which do include local authorities, county, city, district, parishes, MPs, GPs, primary care networks, the email e-letters, mail drops, distribution of summary documents, questionnaires. If you go, and all the digital media, I think if you go through what you've listed on 14 and 15, that is the way to do a public consultation. So well done to the LLR CCGs for putting this as a very full. I'm sure your mailbag is going to be very, very full.
It is, yeah. Yeah, I'll pass that on to our comms team. They'll be pleased to know that, Lee. Thanks.
Okay, I have Mr. Kaufman would like to ask a question, sir.
Yes, social media, you did mention that you're using it. I'm a great believer of the leaflet through the door, but my younger colleagues on the districts tell me I'm old-fashioned and people don't read pieces of paper anymore, but judging by the number of leaflets I have from pizza places, I assume they do. Are you going to at some stage be able to break down where the consultations come from and sort of what percentage of stuff is being done? What was it through Facebook and Twitter and stuff like that?
Yeah. And we've got a team working with our CCG comms team to be able to do that, because that's important for us to see whether or not we have reached populations appropriately. So we need to know which sections of the community it's come from. It also helps us inform future consultation processes as well, if we know where we've had the biggest impact. So that information will be really important to us and will inform that mid-consultation review in case we need to adjust anything.
Okay, thank you. I have no more hands up for questions, so I take it that members are happy to note the consultations arrangements, which are due to begin on the 28th of September, and we look forward to getting reports back as it goes forward. So good luck with that, Caroline.
Sorry, can I just...
Yeah.
You put your hand up as well, so.
Yeah, I just wanted to, having read through it, there's a lot of online stuff, and I accept that, and I accept the circumstances in which you're carrying out the consultation means that you can't actually get people in the room. But I think we do need to just be mindful that not everyone's using the digital platforms, and so ensuring that there's enough information going out to people about how they can engage with the consultation, but offline.
Absolutely, and we are looking to see where we've got high footfall areas to have physical information. Obviously, the letter drop through everybody's doorstep is a way of engaging people in a non-electronic way, but also what information we can have where people are presenting to the health buildings is another one. But thank you for that. We'll take that back.
Thank you.
Okay, thank you, Caroline. Before I move on to the next item, I think I said to Jane earlier, I said thank you for joining us, and I think you're presenting something later, but I've looked through my notes and I don't think you are, so apologies if I gave you any heart attacks with your joining the meeting there, so hopefully you're here as a member of the board. So, item 7, I'll move on to the Better Care Fund Plan 2021, pages 29 to 54 in your agenda packs. The report provides the Health and Wellbeing Board with an overview of the progress to refresh the Leicestershire Better Care Fund plan for 2021. And now I'll hand over to the Director of Adults and Communities, John Wilson, to present the report. Thank you.
Thank you, Chair. So the report that we've got today is not dissimilar to the previous conversation that we had at the board on the Better Care Fund. So this is the update that we will provide to the board on each occasion. As it says at paragraph 4, the framework for policy framework and guidance, technical guidance for 2021 will be published in due course. We still haven't had it, despite the fact that we're now towards the end of September. We're expecting it within the next couple of weeks. That's the sort of the nod that we've been given. And we're expecting then that we'll get maybe 4 to 6 weeks to turn it around and send it back, complete it and send it back. So it's one of those things where, unfortunately, we've waited sort of 10 months to get it, and then we'll get a very short period to actually undertake the work and submit it. What we've got in the report today, though, does give a flavour for board members of what will be in that final submission. So within the appendices that we've included within today's report, that gives a good indication of what we think we will be asked to submit. So we're expecting that the 2021 policy document and guidance will be essentially an update on the 1920 document. We're not expecting that there will be a great deal of change. We think it will be a reporting by exception in terms of any changes to the way that we've been delivering the Better Care Fund locally, any changes to the expenditure plan, or any significant changes in terms of areas of priority and focus. It may well be that we have to submit the plan between boards, depending on what the timescales and dates are, and that being the case, one of the recommendations is that the integration executive, which supports the Health and Wellbeing Board, be given the job of assurance on the plan, and that the County Council's chief executive sign the plan off for submission if it happens between boards, if the board can't do that itself. In terms of national conditions, we expect they will be exactly the same. So we're not expecting any change in national conditions this year, except that on paragraph 11, you'll note that 11D relates to managing transfers of care. And of course, we have changed focus from managing transfers of care to implementing the new discharge to assess guidance as a result of the pandemic. So we expect that there will be a tweak there in terms of the reporting, which will be a focus on discharge to assess implementation rather than delayed transfers of care out of hospital. The strategic narrative, which is Appendix A, is, as I said, an update on the previous year. We haven't really changed a great deal within there. The figures on the BCF income and the size of the fund, 62.4 million for Leicestershire, and that's just an increase in line with the inflationary increase and the uplifts that particularly the CCGs were given this year. The expenditure plan we are reviewing as we speak, but we haven't made any significant changes other than a few additional items that we brought in that we were able to bring in because of the uplifted expenditure. In terms of metrics on paragraph 24 and Appendix D, just to note that the bottom two metrics 3 and 4, are not being counted this year. So delayed transfers of care and non-elective admissions have been suspended as a result of the pandemic. The top two, metrics 1 and 2, we are continuing to count. So permanent admissions of older people to residential care and the proportion of people who are still at home 91 days after discharge. We are still continuing to count those. We don't know yet. We haven't had confirmation yet as to whether we will be asked to submit those figures and whether we'll be asked to continue to provide a target for 2021 for that. We're anticipating we will, but we don't know, and we're not sure what the metrics 3 and 4 will be replaced with. So there may well be a new metric around the discharge to assess process and the home first process. I think that's possibly all we need to say. The timetable for decisions is simply just some information about the sort of the decision and governance process that we went through last year, just to give an indication of what we might have to go through this year, but obviously the dates will all be very different. So it's just really for information. I'm happy to take any questions on that.
Okay, thank you, John. Would anyone have any questions? I have no hands up at the moment. While I wait to see if any hands go, I mean, just observations. Interesting on the metrics. I mean, that makes total sense. You can't have a metric that has had 6 months of complete disruption. So that's good to hear. Be interesting to see what they do replace it with. And just for my information, I mean, it was good that there's so much detail in the report there. It was good to get the agenda back out on time. So just thanks to the officers for that, because I think that is helpful. So, John, I don't think we've got any questions, so I think with that we can say thank you for your report. And yeah, we are asked to note the contents of the report, approve the provisional BCF outcome metrics attached as Appendix D, noting it's subject to changes as John's just outlined regarding the required following the publication of the guidance. Approve that the Chief Executive of Leicestershire County Council, following consultation with the Chairman of the Health and Wellbeing Board, be authorised to finalise the BCF plan refresh should the publication of the national guidance as submission date not align with future meetings of this board. And also note that members of the Integration Executive, a subgroup of the Health and Wellbeing Board, who are responsible for the day-to-day delivery of the BCF plan, will be asked to indicate their agreement ahead of the final submission to NHS England. Okay, thank you. I'll now move on to item 8. It's a report on the progress of the Health and Social Care Sector Growth Plan 2017-2020. This report presents an annual progress update on the LLR Health and Social Care Sector Growth Plan, which was originally published in 2017. We have Kate Revel, Head of Service, and Caroline Boucher, Head of Business Intelligence, who have joined us to present this report. So I'll hand over. Thank you.
Good afternoon, everybody. This is Caroline. Can everybody hear okay?
Yes, thank you.
Okay, thank you. So I'm going to start just by setting a bit of the economic context, and then Kate is going to talk in a little bit more detail about some of the activities that have been delivered, especially the recent COVID-19 work, which has been quite considerable in this sector. We have reported previously on this item to the Health and Wellbeing Board, and the plan is now coming to its end. So it was covering the time period 2017 to 2020. So perhaps in this context, I'm going to talk a little bit about the next steps as well. So just to say a little bit about why this plan originally came into being, and that was largely because the Leicester and Leicestershire Enterprise Partnership had not included the health and social care sector in its list of priority sectors, even though the sector was a large employing sector and really crucial to the smooth running of the local economy. And it was also a sector, and continues to be a sector, that faces a number of well-recognised challenges around recruitment, retention, image of the sector, resiliences of the businesses within it, and because it wasn't a priority sector, the sector was excluded from perhaps some of the grant programs that came out, some of the European funding programs that came out in the early days of the local enterprise partnership. So we produced the sector plan off the back of quite some considerable research and evidence, and we structured it into 4 key themes, which were improving the image of the sector, supporting the sector with resilience and growth, developing and retaining the current workforce, and attracting a high quality workforce. And I think the real thrust of the plan was not to duplicate existing activities, but to add value, influence and coordinate wherever we could. And I'm pleased to say that over the course of the plan, the sector has been added to the LEP's priority sectors, and it actually featured very strongly in the draft local industrial strategy that the LEP was ready to submit to government in March 2020. Unfortunately, as we all know, COVID took over in March 2020, and the local industrial strategies, we're not quite sure of what the current status of those documents are with government. However, the LEP is now producing an economic recovery strategy, which includes both the some short-term objectives, but also those longer-term objectives from the local industrial strategy that they've been planning to submit. The timetable for producing that document is to get something ready for February 2021. We're doing everything we can to make sure that the health and social care sector features prominently in that document, and we've really no reason to think that that won't be the case, because our links and working relationships are very good. The evidence is very strong. The latest forecasting work that we've done shows significant growth required in that sector to meet future needs in terms of the workforce. So we're confident that the sector will feature strongly, and then we're recommending that we would renew and refresh this sort of growth plan off the back of that more all-encompassing strategic document for the economy. So the next steps would be to take that forward, but within the context of that wider strategy for the local enterprise partnership and indeed our local area. So I'm going to hand over to Kate now to talk a little bit about some of the key achievements that have been taken forward through the plan.
Thank you. My name's Kate Revel. I'm a Head of Service for Strategic Commissioning and Quality in Adults and Communities at Leicestershire County Council. Within Adults and Communities, we've been working very closely with economic based colleagues and those within the health sector, around the sector growth plan, and you've heard Caroline and I speak to you before about progress with the plan. There's no doubt that I beg your pardon, sorry, I'm having a little difficulty with my screen. If everybody can hear me all right, sorry, could somebody just confirm that they can hear me? I've been having some connectivity problems.
Yeah, that's fine.
Thank you, that's helpful, thank you. What I just wanted to do was to demonstrate a number of measures that adults and communities have been contributing towards the sector growth plan, particularly at this time of COVID response. Leicestershire County Council, and I know that the other local authorities have had similar measures in place for working with the sector to ensure their economic viability going forward within this period of COVID-19 response. And we've been engaging extensively with providers throughout the emergency to understand further their challenges and concerns, and to tailor the local authorities' response accordingly. We've also taken the opportunity to communicate important information to them, so it's very much been a two-way flow of information to ensure that we support providers through this difficult time, and quite often the challenges do financial considerations and support and viability matters. Matters relating specifically to workforce have included, for example, personal protective equipment, infection prevention and control, including distribution of the National Infection Control Fund within Leicestershire, and obviously that's been the case within Leicester and Rutland too, as well as testing and recruitment. I wanted to just take a moment or two to specifically cover the initiative that Leicestershire County Council have put in place. We've had it in place for the last couple of years, our Inspired to Care team, which has focused on aims specifically tailored to the sector growth plan. So the aims of the team is to improve the image of the sector, supporting the sector with resilience and growth, developing and retaining the current workforce, and attracting a high quality workforce. So very much aligned deliberately with the sector growth plan. So Inspired to Care substantively works with providers, particularly around recruitment and retention and workforce matters. During the COVID period, it's tailored its approach to provide a bespoke recruitment agency, which has assisted providers in recruiting a number of individuals to the local workforce, and has helped in a very hands-on way with those recruitment and retention challenges. And the feedback that we've had from providers has been that that's been incredibly helpful in shoring up the workforce at this extremely challenging time, and in turn supporting with their economic viability. So that's just one example of how Leicestershire County Council, for one, has supported the workforce not only in a strategic way through the sector growth plan and the development of the Inspired to Care initiative, but also in a really hands-on way with the recruitment agency approach during the COVID period. And just going back to what Caroline was saying earlier, although the plan in this format is drawing to a close, there's no doubt at all that we'll continue to work with economic development organisations and partners to ensure that this type of approach continues going forward.
Okay, thank you. Thank you, Kate. Thank you for Caroline. I have no hands up at the moment. Any questions from members to either Kate or Caroline? John.
Yes, thank you, Chair. Not a question particularly, but just a vote of thanks, really, to both Kate and Caroline, but also to other colleagues who I know have been heavily involved in this over the last 3 years. And that's from across health and care organisations and across LLR and within the LEP. I think when we set this piece of work off some years ago now, whilst obviously health and care and the sector, health and care sector was a major employer within the local area. I'm not sure that there was a full understanding of the contribution that the sector makes to the wider economy, nor of the requirement within the sector for additional support, particularly around growth and development of the sector. I think that understanding is much greater now than it ever was, and I think that's evident in the fact that, as Caroline's pointed out, health and social care will go forward as a priority within the future industrial strategy and with economic partners. So I think that's a testament to the work that's taken place, and I think I just want to give my thanks on behalf of the board for the work that's happened.
Okay, thanks, John. No more hands. So can I say it's a great piece of work, and I think going forward with the work that we're doing, obviously the LEP with new governance arrangements in place, I think it shows what can be done. So the board is asked to note the recommendations on page 56, which is the final year's progress in delivering the health and social care sector growth plan. The cross-system workforce initiatives which have taken place during the COVID-19 period, the intention to include the sector in the economic recovery strategy that is currently in development, which we've heard about across Leicester, Leicestershire and Rutland. A new plan for the sector will be developed once the economic recovery strategy has been finalised. And finally, that the new plan will fall within the economic recovery work being led by the LEP. New governance arrangements will be put in place for the economic recovery strategy and will incorporate work in this sector. So I'll just thank Kate and Caroline for your presentation. Thank you. Okay, good timing. Mike has just joined us, so I said we'd take Mike's item, which was number 6, and we'd take it after that item, number 8. So the next item fittingly is entitled, no surprises, Coronavirus COVID-19 Impact and Response to the Local Care System. It's the report in the back pages 19 to 28. This report provides members with an update on the impact and response to the coronavirus pandemic by our local care system. So I'll now hand over to Mike as Director of Public Health first, and then I believe Caroline and also John Wilson will also present elements of the report. So Mike, welcome, and I'll hand over to yourself. Thank you.
Yeah, thank you, Chair. So I'll keep my bit fairly brief. I guess by this stage I was hoping that the COVID report that we would do would detail how we'd cope with COVID, and we would be in a remarkably sort of shallow period when we could concentrate on our planning and our arrangements to deal with the winter. Clearly things haven't quite gone to plan, and that expected second wave has probably come upon us just a little bit earlier than we thought it might. I won't go into huge detail because members of the board will know that I can rabbit on about the data for some considerable lengths of time, but probably enough to recognise that we started seeing a sharp increase in numbers pretty much at the start of the month, certainly from about September the 4th or 5th onwards. And although the focus has been on the sort of really high rates that we've had in Oby and Wigston, which thankfully have dropped off in the last 2 or 3 days, it is something much more widespread than we faced in over July when we had the Leicester lockdown. So you're looking at rates today in Leicester City have gone again above 100 cases per 100,000. Blaby and Oby and Wigston both hovering in the 70s, and just by way of kind of translation, if you like, the worst day we had in Oby and Wigston over the summer was a rate of 80 for a couple of days, whereas now we're seeing rates of 70 consistently in 2 districts. Charnwood is creeping up, and even the other ones, which I would say don't present any special problems to me. I was just looking at the number of cases in the fortnight just ended compared to the fortnight that would have ended at the start of the month, the 1st of September. And it really is stark how things have increased. So Charnwood, just by way of a couple of examples, Charnwood had 21 cases in the fortnight that ended the 1st of September. In the last fortnight just gone, ending the 21st of September, there's been 150. Oby and Wigston had 24 cases a month ago. In a fortnight, the last fortnight has got 114. And even somewhere like Harborough, which by and large has escaped any kind of publicity or measures, 25 cases in a fortnight a month ago, and then 57 in the last fortnight. So we've certainly seen at best a doubling, and at worst rates over a fortnight 4 or 5 times what they were just a month ago. In terms of the paper, clearly the LRF, apologies I was late joining, I was just joining the strategic coordination group of the local resilience forum. continues to lead the multi-agency response. Part of that, or alongside that, is the Health Economy Strategic Command Group, which I'm sure Caroline will cover as well. But we should really come back to the purpose of the paper, which is just to reassure the board, or at least to describe what partners are doing to plan for what has now become the rising tide that's sort of at our ankles and heading towards our knees, as opposed to something where the tide is still out. That's probably all I want to say, Chair, so I'll maybe hand over to Caroline first.
Okay, thanks, Mike. Caroline, would you like to continue?
Yeah, thank you, Mike. So picking up on some of the NHS aspects here, in terms of the arrangements for COVID planning, we've got our own strategic health economy strategic group and health economy tactical group, and subcells where we've divided all of the actions for COVID into that command and control structure. And that worked really well in terms of phase 1. So as we go into phase 2, we haven't stepped it down at all. So we've reduced the frequency, but we're ready to step up as appropriate. And I think the work that we're doing jointly with Mike's team around monitoring the data through our local SAGE group is exactly where NHS England want us to be, that we're responding to local data rather than looking at it from a national perspective. So the challenges facing us going forward is to think about recovery within the context of a second wave of COVID. And we have just submitted our phase 3 recovery plan, which requires us to focus on cancer weights, 52-week weights, etc., to try and get us back to a pre-COVID position. And so a lot of our effort at the moment is focused on there, and it does the paper does pick out some of the issues and some of the areas of focus for our phase 3 safe restart. I think sort of echo some of the things that Mike was saying about the way we've integrated our teams going forward and supported our populations across the health and social care community. I think that's been really important. And we need to really build on the learning from phase 1 as we go into any second stage of the pandemic. I'll probably pause there. Lots of information in the paper, but if anyone's got any questions, happy to take them. And we've got Sarah Premer as well, so particularly around the phase 3 stuff, Sarah will be able to support.
Thanks, Caroline. John, is there anything you wanted to add at all?
Yes, thanks, Chair. So as it says in the report, we are continuing from a social care perspective to maintain our engagement with, particularly with the provider market. So I think we're now up to our 46th information bulletin that we sent out in the last 6 months. We continue to be in regular contact, teleconferences every week with our providers, individual conversations with providers where that's required on a weekly basis. There are some issues that I'll pick up in a second around the provider sector. One of the other big areas of activity has obviously been around the changes to hospital discharge. So working in connection with our colleagues, particularly in UHL and LPT, developing the new discharge pathways has been a challenge for all of us, but actually it's been very successful over the last 6 months, and it continues to be a successful piece of integrated pathway development, and has meant that people have been moving out of hospital in a more timely manner, which is excellent. Alongside of that, and looking forward over the next few months, we have obviously got a lot of people who have been through hospital and discharged from hospital over the last 6 months who have been funded by the NHS throughout that period. We now need to review those people, and so we're working together with colleagues, particularly in Mids and Lancs CSU, to undertake reviews and reassessments of people to determine whether or not they will continue to receive health funding, whether they'll receive social care funding, whether they'll be self-funders, what their care arrangements need to be in the longer term. So that's a big piece of work that we're undertaking now, and we will be undertaking that between now and the end of the year. In terms of the other big challenges, obviously the financial challenge you can't ignore. around about probably £15 million additional cost just in social care alone, through additional payments to providers to meet the additional costs that they've been having over the period. In terms of the provider market, the issues are for the provider market, a couple of issues around kind of provider sustainability. The first is around demand and changes in demand, and that particularly impacts on the residential care market and on the day and community services market. So the residential care market, there has been a very big reduction in new admissions on a permanent basis to residential care. That's been slightly offset to some degree by an increase in temporary admissions, but notwithstanding that, capacity in the market has meant that we now, whereas previously we had something like an 8 to 10% vacancy rate, we now have about 18% vacancy rate. So it's significant, and with some providers that's significantly more than that. So for those providers, there will be an issue about continued financial sustainability, and we are developing some plans to address that. In terms of day and community services, of course, people haven't been able to attend building-based services in the way that they did before due to social distancing and to protect people from infection. We have found all sorts of new and alternative and different ways to provide people with services, but they are very different services. And so we have a whole care market that has been established for many years that is now having to reconsider its role and its function. And as a council, we've been continuing to support providers financially through the process, but obviously that level of support will need to change over time. And then the other big issue, of course, is the workforce issue, and particularly as we go into winter, and with the additional impact of COVID, the domiciliary care sector will need to maximise its capacity as far as it possibly can. And notwithstanding all of the good work that we just talked about in terms of the Inspired to Care approach and getting more people into the sector, we will expect that as we go through winter, we'll see pressure in that market, and we'll need to address that. So that's probably what I just wanted to say. Thank you, Chair.
Okay, thanks, John. I mean, I think the fact, one of the statistics in there on page 24, the fact that we've been adult social care, public health, and obviously the community support groups, the district councils and the borough councils coordinating, aiding the 25,000 clinically vulnerable people identified as requiring shielding in Leicestershire. And when you look at the deaths, I mean, I think the current death total today, obviously these figures in the report, you put a figure out today, it's obviously changed by tomorrow, but I think we have 540 recorded deaths in Leicestershire. When you look at 25,000 clinically vulnerable people, I think that's a tribute to the work that's gone on and how we've managed to make sure that those people's shielding have been protected, and a lot more people out there as well that could be added to that figure. So I have a few people with their hands up, so I'll start them off in order. Harsha, do you have a question or a comment?
Hi, I've got a couple, if I may. Firstly, obviously, as a result of COVID, a lot of people aren't accessing daycare services that they would have accessed, and I know that's the right thing to do in the current circumstances. But what's being done to support people to avoid that social isolation? And obviously, people being at home more, it could mean that they're actually now frailer than they were in February because they're only walking around their small homes or small gardens rather than doing some of the activities that they would normally. So it's point number one. Secondly, what data do we have in terms of the longer term impact of COVID? So those that have had COVID and survived, on people's health going forward, and what is the system looking to do to support them going forward? And we at Health Watch are already starting to hear about flu vaccine programme and the shortage of vaccines being available. And I wonder if someone might be able to comment on that one, please. Thank you.
Okay, Chair, shall I pick up the issue about the day services?
Yeah, please. Yeah, carry on, John.
Well, I'll kick off, and Kate might want to come in because Kate's been in direct contact with providers on a regular basis. But I'll just give her a couple of minutes to think about that whilst I start the conversation off, rather than putting her on the spot. So yes, absolutely. We do understand that not attending those services will have had a major impact on a number of people, and not only on individuals, but on families and carers as well. There are plans in place to start to bring some of those services back. And certainly, just in terms, I can talk in terms of the county council services that we operate directly. We've risk assessed all of our buildings. We've ensured that all of the buildings are safe to bring people back. Obviously, it's not the same capacity as it would have been previously. We've undertaken reviews, and we've talked to all of the service users and their families in terms of what their preferences would be. And some people want to come back, and some people are not kind of keen to come back yet, actually. And people have been receiving alternative services, and we need to think about how that develops over the future. But Kate, do you want to talk about the wider market?
Yes, I mean, certainly to develop John's explanation there of what we're doing around our community life choices or day services provision. At the start of the pandemic period in mid to late March, really there was no alternative other than to ensure that people were physically safe and were able to be supported in ways other than in building-based environments or ones which required them to have very close contact with people who weren't within their immediate family or support network. And so as a result, building-based services needed to close. However, we're conscious that things have moved on significantly. The current guidance supports this type of provision if it can be provided in a COVID-safe manner. What we obviously need to ensure is that there is a balance between people's well-being and the appropriate support that should be provided to them in an ideal world with the COVID based risks. And so there's a robust risk assessment process underway, which we're undertaking hand in hand with providers and with the people accessing those services and their families to ensure that their needs and support requirements are identified, but that is effectively matched with a type of service being provided to them, and that the buildings in which they're taking place where that's relevant are COVID safe. Now, we recognise that that's not a quick thing that can be done. It needs to be done safely and robustly, but we are working very closely with individuals who access the services, their families, and with providers to make sure that's done in as timely and as safe a way as possible.
Okay, thank you, Kate. Next question from Mrs. Radford.
Thank you, Lee. It was really when Caroline was talking, but I'm really not sure whether it does fall under this remit. I've got concerns that some of the elderly aren't looking at getting health care because they're frightened of going to the hospitals and what have you. Where does it fall under the remit? Because you said we're learning from when it was the spike, the first COVID spike, and the government built a lot of Nightingale units, but they're still saying that the people with COVID are going to go to hospitals. Surely, if we've still got the Nightingale units, we ought to be better to use those and keep the hospitals for people that need other care. Because, I've got quite a few residents who were a bit reluctant to go to the doctors or go with cancer and what have you, because they didn't want to pick up COVID. Whereas if we can isolate completely the COVID people, it might be better. And in Shepshire, because I'm chairman of the community bus, we've now started taking people out on their shopping trips. And I think the banners were put out. They wanted to have the balloons flying and everything the other day. And then everything seems as though it's closing down again. So they've done one shop in 6 months and they've got to go back to isolation. But I think we've got to look, and it's further down about the mental health on it. We've got to make sure that people still can get out and about. But I don't know whether it comes under this remit, that I think we're in the Nightingale a bit more.
Yeah, so I think it's a really good question, because people were afraid to come into hospital. Over the summer, we've done a lot to put in place infection prevention and control procedures in the trusts, in both the Partnership Trust and in Leicester hospitals, to ensure that where we can keep people separate. So if we've got people coming in for routine surgery, we can screen them and isolate them before admission, so they come into a clean area, and those people who we're not sure about, they will go into a COVID area. And we've got John talked about discharging patients and really making sure that we've got a good process for discharging them. And we opened up hundreds of beds in the first wave of the pandemic to accommodate the need for different usage of beds. The challenge about the Nightingale units is, if I look at my colleagues across in the West Midlands who did use some of the Nightingale beds, they had to release staff to staff them. Oh, right. And that makes it really difficult for us to think about how we continue to staff our own buildings, but also release staff to enable them to go to the Nightingale as well. So the decision we made locally, because of our numbers and because the numbers were fairly low locally and we can manage within our own bed base, was that that's what we would do. If the situation changes going forward, we'll have to relook at that. But at the moment, it's easier if we maintain things within our local footprint. We were also getting feedback that patients didn't want to go to the NEC, which is where our local Nightingale Hospital was, because of the distance away from everybody that they knew. And, you know, travelling such a large distance to a hospital when we can manage them locally is one of those challenges that we've just got to work through.
Can I just come back, Lee? I mean, I was aware that we'd done a good job in our area, but yeah. I think, you know, people did have concerns, didn't they? And I think that's something, if we do get a spike, that we have got to make it very clear that people are segregated. And I am aware that when, well, in fact, a couple of people of mine, you know, went to hospital and they said how quiet it was and how good it was. Yeah. But I think we really need to make sure that residents are aware that it is
we've got to
safe,
get that
what have you. Which
yes.
I think everybody panicked at the start of the COVID.
They did, yes,
and all reasonableness lost the way, didn't it?
Yeah.
Yeah. Okay. Thank you.
Thanks, Christine. I have three more speakers indicating I have Jeffrey first, and it'll be Jane and then Vivek. So, Jeffrey, your question.
Hello. Thanks very much, Chair. Not wishing to be controversial, as I never am. I think it was John that was talking about staffing recruitment and staffing levels and recruiting in this plan. Nobody seems to have mentioned that on January the 1st, we will be in a different position politically outside Europe. I know this COVID thing has taken over everybody's thinking, but things are going to change big time. Is it not going to affect this plan? Or has anybody thought about it, or we just got enough on our plate? Because I can't imagine what will happen I don't think anybody can. So I just wondered what the thoughts were.
Okay, thanks. I'll start, and other colleagues might also want to contribute. So we have done a lot of planning, as you'd imagine, across health and care sectors. Now, obviously, a lot of that planning was this time last year and leading up to, but the plans remain in place. And we are bringing them back out, and we are now having conversations about the impact of the EU exit. In terms of social care, we don't have a lot or a very high number or a high proportion of our social care workforce which is from the EU in Leicestershire. It's about 3%. So we're not expecting that there'll be a very big impact on the 1st of January, as it were, from people leaving the UK and moving back to other EU countries. There may be an impact, and we're anticipating and working through the possibility that people in other sectors So be that in retail or other sectors of the economy who might be from EU countries who might move back, and that might then mean that people who worked in social care may move into other sectors, as it were. So there could have been a more indirect impact. Again, at the moment, we're not expecting that will be a critical impact. We've no reason to believe that's the case. We've talked to providers, we've got business continuity plans in place with providers, and we're working through all of the issues as you'd expect. So at the moment, we're comfortable with where we are. One of the issues that might impact on us more than workforce could be availability of equipment. So quite a lot of equipment, PPE and that kind of thing comes from Europe. So we're just making sure that supply chains and what have you are robust. So that's one area, but other colleagues might want to also contribute.
Anyone else? No. Mike?
No, nothing for me, thanks, Chair.
All right, thank you. Thank you for that. I have Vivek, who'd like to ask a question.
Brilliant. Yeah, thank you, Chair. Just for clarity and for conflict of interest, just to inform you that my wife works for a private care company, which is all registered in the East Leicester CCG's sort of conflict of interests register there, but just so that the board is aware of this as well. So my question is really around the resilience of care homes and care agencies, really. I was quite surprised to see that bed occupancy had dropped so far. I think John quoted 18% in some areas, and that just gives me a bit of a bit of concern, really, about their viability. Because obviously we rely on these private businesses to look after our most vulnerable patients, actually. And I wonder if there's any hotspots that there are out there, and what's being. I know that you're doing a huge amount to support them, but is there anything else that we need to be aware of, or we need to do as a system to try and support them?
Okay, thanks. Yes, so the overall occupancy rate, or the vacancy rate is about 18%, occupancy rate's the opposite of that, so 70, 71, 81, 82%. So that is a significant shift from where it was. So it's increased by about 10%. We have 4,500, 5,000 beds across the county. So we're looking at an order of 500 possibly beds. The impact is variable. That's the first thing to say. So if you look at across the 180 care homes registered in the county, we've had outbreaks, 89 outbreaks. Some of those will be duplicates, so there'll be care homes that have had more than one outbreak, which means that we've got 50% of our care homes haven't had an outbreak at all. That's one thing to say. We know that there are a small number of homes that are heavily impacted. So we've got a small number of homes that have got maybe 40-50% occupancy. Clearly, there are significant viability issues in that sense, but there are other homes who are still running at 90-95% occupancy. The initial reduction, and the reduction was due to a number of factors. One was around the fact that there was a confidence issue in the sector. So the majority of admissions to care homes are made by individuals and families in the community and through private arrangements. There was a bit of a confidence issue, and families decided we're sort of perhaps a little bit more reluctant to place loved ones in residential and nursing care than they had been previously. There's an issue about the new discharge process that we implemented. And of course, there was a greater number of people who sadly died in the first few weeks and months of the pandemic. What I think will be interesting will be to have a look at mortality rates through the rest of the year and see how that, because it might be that what we'll see is an evening out, actually, to some degree. throughout the year. I think it's fair to say that numbers are beginning to go back up in terms of admissions. So it's not a static kind of piece. I think what we're probably seeing now is that there is a bit more confidence coming back. So numbers are beginning to increase. The care home sector itself is a much more robust than it was in terms of its response to COVID, and actually it's probably its response all round in terms of other health conditions and the support that we give it as a health and care sector has much improved. But yeah, we are looking at it, and we are putting in place some plans to address what we think will be the major issues and the major risks, and that will be kind of varying levels of support that we might, as a local authority and as a system, put in place to support providers. But we might see there might well be a contraction in the market. There may well be. And given that we had 10% vacancy rates previously, the market might be able to withstand some of that.
Thank you.
Can I just check with Jane? I know we discussed about not having a question, but was there a point you wanted to make at all, Jane? Are you okay just to move on?
No, I'm okay, thank you. The point was made. Thanks, Lee.
Yeah, just making sure. Thank you. Okay, I think that's been a good conversation. I mean, we didn't know about COVID until the end of last year, and I think all of you around the table have always had your full-time day job to do, and on top of that, we've now had to deal with the outbreak and the consequences of coronavirus and its impact. So just well done to all of you around the table, and thank you for a good conversation. We're asked to note that report, so yeah, certainly thanks to Mike. I don't know whether you're staying with us, Mike, or whether you need to shoot off. I know you've got other meetings to deal with this afternoon, so it's but thank you for
I'll stay. There's half an hour till I get my green room and my rider and start appearing on TV again. There we go.
Okay, thank you. Item 9, our next report is a report of Health Watch Leicestershire using child and adolescent mental health services. This report outlines the finding of Health Watch Leicestershire's special project to look at people's experience of using the CAMS services. Becky Engley, Senior Analyst, will present this report. So Becky, if I can hand over to yourself, thank you.
Hi everyone. The CAMS report that we've produced, it kind of came about through conversations and concerns that we'd heard from people trying to use the CAMS service. We were aware of the fact that the CAMS service had put in a number of measures to improve it. And so then I suppose we wanted to know how people were finding the service kind of based on the improvements that had been made. So the project itself, a survey was produced, which was available to people online to complete. Health Watch members of staff also went into waiting areas both at Westcoats and at Valentine's Road to ask people to fill in the surveys face to face as well. So we had 90 surveys completed all in all, with 87 people saying that they were, okay for their information that they'd provided to be used in the report. So just looking a little bit at the demographics, I think that 60% of people who completed the survey were from the city, and 40% of people lived in the county. So I suppose just from the kind of the high level findings of the survey, I think that a lot of people do still find the wait between referral to their first assessment, and then also from first assessment to actually receiving, treatment starting or a care plan being implemented. That is still something that people find a poor experience. We did ask about signposting kind of during that waiting period, and whether information was provided to, assist people during that waiting period, and whether they found it useful or not. And I think that there's still quite a high percentage of people who don't receive any kind of signposting at all to different support services that they could use during the wait period. I think it was something like 38% of people said that they hadn't received anything at all. And of the people who had received signposting information, just over 13% said that they hadn't actually found it very helpful. So in the recommendations, this was an area that we've kind of recommended that maybe the signposting could be looked at, to make sure that it kind of does meet people's needs, and that it is being offered to everybody. And then when it came to the actual assessments themselves, and also the care plans and treatment that people received, people's experiences definitely seemed quite positive in those areas. So, a lot of people said that the information provided in the assessment was clear. Over half of people said that they, completely agreed with their care plan. And so I think that once people actually kind of get into the CAMS service, and the experience that they have can be a very positive experience, but unfortunately the kind of the waiting times can have a detrimental effect on people's mental health. So during the kind of wait times from first assessment to actual treatment and care plans starting, quite a high proportion of people said that did have a negative impact on their mental health already. So I suppose that then they're kind of starting from a worse position than when they were first referred by the time they actually get to treatment. With regards to, we also asked questions around the venues themselves and how easily people found to get to them. Trying to get to appointments and that kind of thing, quite high percentages, like 80% plus, said that the venues were easy to get to. Some people did talk about that they found it difficult to park sometimes, but only a very small percentage, I think it was literally 2 people, said that it actually made them late for appointments. And then, I think the only other point that I wanted to make was just around information that's made available to the public on how they can actually raise a complaint. I think 43% of the people who completed the survey said that they wouldn't know how to make a complaint if they wanted to. So again, that was one area where we thought that, if more information could be made available to the public, either in, information available at reception and that kind of thing, then again, that would add to people's experience of the service. So I didn't know if anybody had any questions or comments on the report at all.
Becky, thanks for that. If I just, before, I know I've got one person with a question, and just before I ask Daniela on behalf of the LPT if she'd like to make any comments. I mean, I thought the responses you got under COVID times was really good. The fact it was an online questionnaire, the works that you would have liked to have done and you weren't able to, I thought the responses you got back was really good. And I think on page 93, it is the final paragraph of your conclusions, that it's overall people feel listened to once they've engaged with CAMS. They know what will happen next. They feel the treatment or care plan meets their needs. And it obviously talks about if delays between being referred and the first appointment could be improved. I think that's probably, we'd all like that definitely to be improved. It needs to be improved. So I think that's always been an issue, certainly since I've been involved in local government, that CAMs have always had that ability, that they've had too much demand to be able to meet those needs in a timely manner. But just before I take Jeffrey's question, Daniela, is there anything you'd like to add or comment on?
Yeah, I can do. Yes, thank you. Thank you for that. I think what I would like to say is, I mean, we welcome this feedback from Health Watch, and actually we've got, just to give assurance really to the board, that we'll be taking the improvement plan around this to our Quality Assurance Committee, which is a committee of the LPT board, as well as actually taking it to our Audit Committee, which is where we look at all external reports that may give us assurance or that may give us cause to pause and respond. I think when we looked at the report, we were pleased in some respects that there were no surprises. So I think it does tell the consistent story for us. However, to some extent, we're now, I would hope that if this was done, if we did this again, I think we should start to find that our first appointments are starting to be accessed within the timescales. With it, that's 4 weeks for urgents and 13 weeks for routine. And we also provide a crisis response. I know it doesn't always help all of our young people, but it's there and available. And also, since COVID, we have established a 24/7 mental health helpline, which young people can also access. And also the all-age mental health urgent care hub. And I think hopefully in response to the signposting, that should be quite helpful. Our concern had always been the waiting times between the first appointment and treatment, and we'd got considerable numbers, and that was highlighted in the CQC report we received probably 18 months ago now. And we did make some really good headway in reducing some of the longest waiters. But sadly, with COVID coming along, it's kind of stopped us in our tracks, and we've seen those numbers increasing. We are restoring, in line with all the other health services, we are restoring our services back up, and we have commissioned some external capacity from both St Andrews and also from Helios. So we're back on to trying to reduce particularly some of those long waiters. But just to say, we are in the middle of signing off the improvement plan in response to the particular Health Watch report. And I suppose I'll just conclude in saying we're happy to come back, potentially in a couple of months, to report back on progress on that. So, yeah, I'll pause there.
Thank you, Daniela. Thank you for that. 2 questions at the moment. Mr. Kaufman first.
Yeah, hello. It was a very interesting report, and it's well presented for people like me that like an easy read. But the question I'm interested in, how did the people select themselves, the 90 people that replied? How did you collect them? Because the results are good, because normally people, I was going to say, perhaps I'm wrong, normally people that reply with something like that have got a grouse. So how did you select the 90, or how did they select themselves?
So I suppose I think that the majority of surveys that were compiled were done through Health Watch members of staff going in at certain times to clinics at the Valentine's Road and at Westcotes. So there was no real selection process, if that makes sense. It was just, if we went in over a 2-week period, I think, or maybe I think it was even longer than that in the end. And if you were there on the day, then a Health Watch member of staff would talk to you and see if you were happy to complete the survey. And I know that I went into to Westcotes, and I think the only person who said to me that they didn't want to do it was somebody who had already done it the week before. So there was no real selection. It was just, if people were happy to complete the survey, then we were there if they wanted to ask questions.
Great, so it was a random sample. Thanks very much.
Yeah.
Thanks, Christine.
Thank you, Chairman. It's a question really for Daniela. So what you commented on urgent and not urgent, but of course all families think their problems are urgent. So I do have residents get back to me to say, they think they're urgent but not. You did mention 24-hour helpline. Now I've looked through the report and I might have missed it, but can you let us have the 24-hour helpline? And you said it's open for young people to contact you as well.
Yeah, I can do. It was stepped up as part of the COVID response. So very quickly, potential harder. I think it's perhaps May, June. It was a service that we were asked to step up alongside many other mental health services. So I'm happy to share that. We try and communicate the availability of that quite widely, but I will take that back, because if there are people not aware of that service, that is of concern. So I'll take that back and just make sure that
I can get Matthew as officer here to make sure that all board members have those information numbers and
brilliant.
details.
Thank you.
Okay, Christine.
Yeah, and can I, because when you, I just reading it before it's made public, really, what is the helpline there for? You said it's for young people. Is that young people that have got concerns? Because I don't want it being, anybody just phoning you up in the middle of the night. Do you know what I mean?
No, it's a helpline that's available to anybody. Anybody can call with a mental health issue. It's a mental health 24/7 for adults, for all age mental health.
Thank you, Danielle.
Jane.
Yes, thank you. Thanks for the presentation of that. I thought it was really clear and great job. Could I just ask a question of Daniela, just around how you engage with service users generally? So I think this is a great piece of work, but I know around your improvement plan, and you talked about taking that through your audit committee, etc. How does that work in terms of going through any accountability to service users and how they're engaged? Just curious, really.
Yeah, I mean, we do have, just on this specific report, actually, we do have a youth advisory board, and actually they reviewed the report on Tuesday. I don't know if Becky's part of that or aware of that. So there is quite considerable engagement, I think, within the children, young people service. Unfortunately, I'm probably not best placed to detail that. So, but something we can get back to you with.
Lovely, thank you.
So, sorry, just to add, I did I did attend the youth advisory board meeting on Tuesday. So they're fully aware of the report itself and asked questions and that kind of thing. So yeah.
Thanks, Becky.
Thank you. Thanks, Becky.
Can I thank Becky? As I said, it was a good information, good presentation. We can also thank Daniela as well. And I'll put you on the spot, but I think you obviously picked up those questions very well and gave good answers. So, and we are asked to note the report, and I think we put some good comments on that. So well done and thank you. And I'll now move on to the next item if I can, which is agenda item 10, to provide an update on the work of the Leicestershire Housing Services Partnership. It is 107 to 110. I'll hand over to Jane as Chief Executive of Wellbeing District, who will present the report to us. Thank you.
Thanks, Lee. So this really is an update, and primarily the work has been done and led by the Leicestershire Chief Housing Officers Group, which incorporates the city and Rutland, so it's LLR wide. As you might expect, quite an emphasis on this report is focused on homelessness, and you'll all know that following the COVID outbreak, there was a government initiative to get everyone in. The initiative was called, and the reduction of rough sleepers. So that has happened, and the number of rough sleepers, that has been actually very successful. Homelessness applications have increased and continue to increase. And I think probably that the benefits of that have been that in order to fulfil the initiative around everybody off the streets, that would normally there'd be some people who are ineligible in terms of homelessness legislation. But of course, that legislation was almost extended to encompass everybody who was a rough sleeper. So there's still no real clarity on how that will be moving forwards for those people who would normally not be defined as homelessness under current legislation. So that is still being actively worked on, and homeless referrals are continuing now, and we're seeing a slight rise. I think the rent arrears position at the moment is they are increasing, but there'll be two significant points. And one is the furlough scheme, although I know there have been some announcements today, but you would expect any impact on furlough or unemployment to see increases in rent arrears, certainly. And you may know that the evictions had been suspended until September. Well, they now have any action on those has now been suspended until next March. So that is actually welcome assurance for renters. So that's the position generally where things are on homelessness. I think it's could be bleaker, but I just think it's just in terms of perhaps timing around some of that legislation. I've incorporated just a couple of other key points that have previously been part of former reports to the Health and Wellbeing Board. One of those was around hoarding. I have spoken about this before. And what's been agreed now collectively is that some monies within the DFG funding will be top sliced so that there can be a consistent approach for hoarding across the county. Talking about an absolute comprehensive understanding of that data, and then having a common policy so that we have a consistent approach across the county. So that's in progress. I've got quite a lot of feedback. I'm not sure if everybody's on mute, but that's helpful. That's better. Thank you. And then I've just incorporated light bulb into this as well, which is obviously a programme funded across the county and the districts. Light bulb, it falls into two categories. Light bulb home, which is primarily about keeping people in their own homes through aids and adaptations and a housing MOT. And then there's the hospital enabler project, which of course is fully funded by the CCGs. So it just gives a background to where we are on that. I'm happy to take any questions and finish there. Thank you.
Okay, thanks, Jane. I'll wait to see if we get any questions. I was just amazed when I looked at pages 107, section 7, the statistics, the comparisons between the city and the county. Yeah, regarding numbers of homelessness, because you always think it's a city-bound problem, but it is startling figures. And I also think it's really good, number 8, where there have been 1,358 people moved into settled accommodation, 387 of those in the city to date. So really good work. And the hoarding, interesting to know the numbers on that as the actual people, because obviously that's a good sum of money, but I'm sure with the work that you have to do, I've seen many a documentary on telly, as I'm sure we all have, on hoarders and the problems and trying to sort of help people that have that. It'd be interesting to see what sort of numbers that actually covered.
I think that's a really interesting point, because when we started this, we know that most of the referral or many of the referrals to the HET project from hospital are a barrier. Hoarding is a barrier to getting people out of hospital. And the budget there we've had to reinforce. And I know that adult social care have a budget for hoarding and the districts have a budget for hoarding. So it's not necessarily all in one place. and I think that we thought it was many in number, and what the data, or the position we've got to on the data, is that probably it's fewer in number, but the costs of those cases are absolutely astronomical. So it's the work hopefully we can do here is to understand the reasons for the hoarding and help that, rather than the cyclical issue that we have is we clean and clear someone's house, they go back into it, they go back into hospital, their house is the same state as it was before. So it's actually understanding that. Just in terms of the numbers of the city and the sort of the numbers that have been moved into accommodation, and I think that really shows the value of the housing services partnership. So it's our relationships through that partnerships with the third sector providers that have really been supportive. So we've worked with those partners for some of us that don't have our own housing stock, working with those providers to come up and provide some of their empty properties to help us to be able to provide that accommodation for homeless families. So yeah, thanks for that.
I've still got no hands up. The only other comment was obviously the good work of Lightball continues. So the hospital enabler team, the fact that you've now got the work on the Bradgate mental health unit as well, that business case approved. So that's as an extension. So yeah, great work.
Yes. Okay, thank you.
I've got no questions. I've got no hands raised. So I'll just take it that members are happy, and we are asked to note the report and the update. So thank you, Jane. Finally, we're on to item 11, which is our last item concerning the Joint Strategic Needs Assessment on Tobacco Control. It's pages 111 to 116 in your agenda pack. We are going to have a presentation here. The report provides a summary of the recommendations that have arisen from the JSNA Tobacco Control chapter. And we have Zahira Chatra, the Integrated Lifestyle Manager within Public Health here at the county, who will present this report. So welcome, Zahira, and over to yourself. Thank you.
Hi, very good afternoon to everybody. Thanks for giving me this opportunity. Matt, can I just check, have I got control of the presentation? Do I have to?
It looks like I might have to click through for you, so just give me a nod and I'll do that.
Okay, well, there's your first nod then. Okay, just a little bit of a caveat before I get started. Just in terms of this tobacco control chapter, obviously it was published pre-COVID, so we haven't got much reference to COVID in it. However, what we do know is that we've got available evidence to show that obviously smoking is associated with an increase in severity of illness and death in hospitalized COVID patients, and as a service we've capitalized on that in terms of the marketing and promotion and getting people through to the service. Next slide, please. Okay, so in terms of the tobacco control level of need, we know that the smoking prevalence in over 18s for Leicestershire has decreased between 2018 and 2019. So that's gone down to 12% and is well below the England national average, which is around 13.9%. The smoking prevalence in adults in the routine and manual occupations increased between 2018 and 2019, so from 22.4% to 24%. But the good news is in terms of access to the service, there's a lot. There's over 60% of this social demographic that accesses the stop smoking support. So we're obviously targeting the right audience. Smoking prevalence in adults with a long-term mental health condition has decreased for the third year, and that's quite positive. So it's gone down to 20.2%, whereas the England average is at 26.8%. Also taking into consideration that if you're looking at this cohort, mental health prevalence, smoking prevalence in mental health is about 40% within this group. The prevalence of young smokers age 15 is similar to the England average, and we haven't got any new data available. I can only assume that a survey hasn't been done yet for young people. Next slide. In terms of smoking at the time of delivery, smoking-related mortality and ill health, the percentage of women smoking at the time of delivery has significantly been decreasing over the last 5 years. In terms of Leicestershire, it's at 8.5% in 2018-19, whereas the England average is at 10.6%. We know that although smoking attributable hospital admissions have increased since 2017-18, the rate has significantly decreased over the last 5 years, and Leicestershire is again below the England average for that. Smoking attributable mortality continues to decrease from previous time periods and again performs better than England average. And our lung cancer registrations have increased since the previous time period, but again remain significantly better than the England average as well. Next slide, please. Okay, so in terms of the unmet needs or gaps that have been identified, there's obviously geographical differences in smoking levels. So if you look at Oadby and Wixton, you have a prevalence of 6.3% compared with Northwest Leicestershire, which has a smoking prevalence of 19.2%. But just a point of note, really, within Oadby and Wixton, as a district, it looks like it's doing quite well in terms of prevalence, but we need to bear in mind within the district there'll be high pockets of smoking prevalence. So, for example, South Wixton would have much higher smoking prevalence compared to the other parts of the district. Leicestershire smoking population equates to about 73,535 people. We know that the lesbian, gay, bisexual people are more likely to be current smokers. Smoking prevalence in routine and manual occupations in Leicestershire is 22.4%, as highlighted before. Therefore, that inequality related to burden of smoking-related illnesses. There's a high prevalence of smoking results, obviously, in excess mortality due to those due to smoking in those with serious mental illness. The looked after children, homeless population and prison populations all have higher smoking prevalence than the average, leading to potential health inequalities. We do a lot of work with looked after children and have got good links to help provide support as and when needed. And of course with Turning Point as well, looking at various projects around the homeless population and smoking prevalence within that. Smoking pregnancy, 1 in 10 women still smoke at the time of delivery. Of course, this has significant risk factors in terms of miscarriage, premature birth, stillbirth, and then your SIDS as well. And premature births are increasing over time as well. Next slide, please. So in terms of the tobacco control recommendations, what we need to do next, some of which we're already doing or have met. So the first one, the development of a tobacco control strategy for Leicestershire to make sure we set out clear vision and priorities to help reduce these health inequalities. This is something that we did start or to look at pre-COVID. And again, it's something that we're going to now look at again as we work in our sort of recovery cells. Reduce health inequalities due to smoking through a reduction in people starting smoking, supporting people to stop smoking, and the management of smoking-related illnesses of diseases in primary and secondary care. We're addressing this already. Obviously, we're encouraging GPs to consistently refer, especially for people with mental ill health. And we're working with UHL on the CURE project, which is a bedside stop smoking project. And so we're looking to address that. Take a multi-agency approach to prevention and to stop smoking support in geographical areas where smoking prevalence is highest, alongside universal access to services. So it's working with our partners, district colleagues, etc., in you know, making sure that there's a sort of multi-agency approach to prevention. Carry out an evaluation of the Quit Ready service. We've already done that and have fared quite well with our evaluation. Looks quite promising. Working in partnership across organisations in Leicestershire, LLR, where appropriate, on areas such as smoke-free housing and inpatient stop smoking services. This is something we identified in the Tobacco Control Action Plan, and part of the Tobacco Control Alliance group. We are working with our district colleagues, Blaby and Northwest Leicestershire in particular, around smoke-free housing associations and tenancy. So having some input there and supporting our housing colleagues to do that. Continue to consider equality of access to stop smoking services, including information and support, especially for those who may face particular challenges, for example, people with learning disabilities and other groups under the Equality Act. Again, something that's on the forefront of what we try and do. Next, please. Ensure that smoking advice and information is embedded within the Making Every Contact Plus approach work stream and training. So we're doing that, working with primary care networks in conjunction with social prescribing link workers. We've just had a sort of training session for link workers around brief opportunistic intervention in smoking cessation. And knowing where and how to signpost into community services for patients. Working with UHL and Leicestershire Partnership Trust, I sit on the smoke-free action groups for both, and I support them with their smoke-free site policies and enforcement of these policies as well. Working in partnership to reach looked after children and supporting them and the places where they live to be smoke-free. Again, it's a service we provide, as I mentioned previously. For specialist services such as prison healthcare, homeless primary care services, to ensure that accessible and relevant advice is provided to these groups in appropriate and pragmatic ways, with support from partners. So we do a lot of training with our partner colleagues. I believe prison healthcare, in terms of we don't have responsibility for that, but NHS England does. Yeah, that's that one. Investigate why prevalence of smoking in Leicestershire may have increased from 2017 to 18. We don't know why that is. I did pose the question earlier the other day to Kajal and Kath, but it's something I'm keen to know why, that we've seen an increase. However, the good news is that since then it's been decreasing. And we will continue to monitor and respond to that trend of smoking over time. And I think that's the final slide. Thank you very much for listening.
Okay, thank you, Zahira. That was really informative, and thank you for the slides as well. I have one question. I have a couple of questions coming in now, so I'll start straight off with Jeffrey.
Yes, I suppose my question is as much to Jane as anybody else. It's the first time it was relating to the lettings, non-smoking lettings, which I understand from this presentation that Blaby should know all about, because I think it was mentioned as Blaby and North West Leicester are doing it. I put my hat on as chair of Obie and Wigston's Health and Wellbeing Board, and we, as was mentioned earlier on, we have a serious smoking problem in South Wigston. So I just wondered whether it's possible for us to learn from you, and I will try and get it on the agenda of our Health and Wellbeing Board, because it's something I've never thought of. I don't know how you enforce it, and I don't know whether you're allowed legally to put it as a condition of a tenancy, but it would be very interesting, and I think we could learn from that. Thank you, Chair.
Do you want me to answer that slightly, Jane?
Yes, and then I'll chip in if you like.
Okay, just to say that we are looking to roll it out to all of the districts, but as a starting point, we're piloting it with Blaby and Northwest Leicestershire in terms of smoke-free housing. This is obviously, it's not so much about enforcement, it is more about raising awareness and education, but also working with our housing officers and colleagues in terms of equipping them with the skills, the conversation skills that are needed to broach the subject of stopping smoking and encouraging smoke-free homes with tenants, etc. So it's something that we piloting first with Blaby Northwest Leicestershire, sorry, can't speak, and then we'll roll it out to other districts, and obviously look at the lessons learned and everything else from the pilot, and look at how we do better with it going forward.
Thank you. Do you want me to come in as well? Sorry.
Yeah, please do.
Yes, just to add to that, because of course we're not a stockholding authority, whereas North West Leicestershire are. A couple of points really. It was raised by a resident with us of East Midlands Housing as something whether we could promote it, and then actually I just picked that up with Zahira, so it has been good. I just wonder whether it might be helpful for me to add this to the agenda for the district housing leads, the district health leads meeting. We're actually having our first meeting since the pandemic shortly, so I think if we put that on the agenda and perhaps share a bit of learning across the offices, that might help. So I'll do that, and we can feed that through. Thank you.
Thank you, Chair.
Okay, thank you. Jane, you actually had your hand up as well, either a point or a question, so if you want to make that as well.
Oh, thank you. Yeah, it was just about whether there was anything else we could do about homeless people, to be honest, and talking about the housing. There is a link in there. I just wonder whether there's something we might offer help with, and perhaps have a separate chat about that. So I'll just leave that as a point, really.
Yeah.
Thank you.
Welcome now.
Thank you. Christine, you have a question.
Sorry, I'm having trouble getting off my mic. Right, yeah. I've never smoked, fortunately, but my daughter-in-law and grandchildren do, and a lot of them are turning to vapes. Do you? But then I read in the paper that vapes aren't good for you either. So are we doing anything to follow on if they are coming off cigarettes or the rolling tobacco, which I understand is just as bad as the cigarettes? Are we doing anything health-wise with vapes? Because when you read it in the paper, that they can have serious health implications as well.
Yeah. So we basically, vapes are 95% safer than smoking. So there's growing evidence to suggest that they are much safer. It's a very effective way to help people stop smoking. It does not have your tar, which is a cancer causing, and the 4,000 plus chemicals that you would get in combustible smoke. It has just flavorings, it has nicotine, and propylene glycol, which is basically water and glycerin. So it is much safer. I would say there's a lot of scaremongering in the media around the harmfulness and the effects of vaping, but we as a service advocate vaping. We provide e-cigarettes as an alternative to nicotine replacement therapy, if that's what people want to use. And we've not seen any issues with vaping at all from a service point of view, but also just generally, it is much safer to use it as a stop smoking aid as compared to obviously carrying on smoking. And we know that a lot of people are going down the vaping route because they are really, really good products, and they are helping people stop smoking, because these are people who would have tried all of your conventional pharmacotherapy in the past, so your nicotine replacement therapy or the stop smoking medication tablets, but they're finding that vaping's really been useful in helping. So I strongly recommend vaping as a stop smoking aid. Definitely. I hope that answers your question, Mrs. Redford.
Yeah. Thank you. I won't be quite so worried then when the grandchildren like.
Don't be.
But they still have to go outside if they're at my house, even if they're vaping.
That's fine.
Good question. I have Mayor who'd like to ask a question.
Thank you. Thank you very much for a great presentation and very clear. A lot of our member practices, so GP practices, ask about more support to enable their patients to quit smoking. You know, we used to have a practice-based, locality-based services. Now it's a phone line and, you know, a card that we give to people. Obviously, COVID has kind of made that appropriate now, but are there any plans to increase support at neighborhood levels for people who want to quit smoking? Services.
Yeah, I mean, the services has always been there. It's been in-house now in public health or as a community service since the 3rd of January 2017. We quite embedded within the community. We're finding that a lot of people that are being referred into the service are finding it, really convenient because it's in a digital format. We offer web chat support. We offer telephone support. It's still weekly. It's still based on your gold standard evidence-based treatment program.
But
GPs.
It was GP. It was embedded within primary care before.
It was, and obviously to make it, I suppose, we've moved with the times, and thank God, come this pandemic, we are ahead of the curve because we're digital, so it's helped. But I mean, the services there, people can be referred either through yourselves as GPs or accessing the support themselves by self-referring. They'll still get 12 weeks worth of nicotine replacement therapy. They'll get 12 weeks worth of behavioral intervention. And it's free at no cost. And to be honest, we do a quarterly survey and have had really, really positive feedback in the sense that people just find it so much easier not having to leave their homes to go to a stop smoking clinic because they're getting it on the other side of the phone. So yeah, it's, all I can say is to the GPs, just keep referring. They'll get support as long as we're around. They'll get support in terms of helping people stop smoking.
Okay, thank you. Thanks for your question. I have no further questions, so what I'll say is Matt will email the presentation that you saw earlier to all members, and it'll also go into the website. So, Zahira, can I thank you for your report? We are asked. Sorry. We are asked to welcome and support the recommendations that were listed, and you've seen those. Of the JSNA tobacco control. So thank you, and I think you can take that as being very well supported. So thank you.
Thank you.
Pleasure. Item 12 on the agenda is the date of the next meeting. The next meeting of this board will take place on Thursday, the 26th of November at 2 o'clock. Guarantee that will be virtually. And item 13, any other items which the chairman has decided to take as urgent? As I mentioned earlier, there are no urgent items. I think really as a lay member, I sit here as chairman, as a councillor. I think that you professional people who join this meeting, thank you for all the great work that you do for the residents of Leicestershire. So keep up the good work and please stay safe, and thank you for your time this afternoon.
Thanks, Lee. Bye.
Thank you very much.
Thank you.
Thank you, Lee. Bye.
Bye-bye.
Yeah, thank you, Chair.
Bye. Joined us again, bless him.